Hi, my name is Michael Brubaker, and this is my video book summary of The Cost of Cutting by Dr. Paul Ruggieri. So the book makes a lot of interesting points, a lot of the stuff that we've talked about through the semester. Some things that stick out the most to me. Well, for starters, he's a general surgeon. He's very interested in providing a transparent take on the challenges that surgeons face in today's healthcare. Profit is a driver for so many things. We've talked about that all throughout this semester, and when it comes to surgeries and patients, it's the same thing. And the patient is the one that's caught in the middle of all of that. So, some highlights were definitely the unnecessary procedures that are done. Unnecessary surgeries are about $150 billion in healthcare expenses. That's a lot of money. That really stood out a lot in my mind. Hospitals and insurance companies, they put the physicians in difficult situations and having to make the determination if surgeries are actually necessary or not. And sometimes the physicians make those decisions based on things that are out of their control, like the hospitals putting pressure on them to do surgeries. Um, and then also the patients, the uneducated patients that don't understand, and they're just demanding to have these procedures because that's what maybe their insurance company is telling them or their primary care doctor is telling them they need, who are all getting benefits from that. And then the physician feels pressured into doing those procedures. 10 to 20% of operations are not necessary. That was something that really stuck out in my mind. And there's less focus on preventative care. He talks about that. A lot of the topics for the papers that the class have written were a lot about the healthcare costs being increased because of lack of preventative care. I had the same situation. That incidental findings thing was very interesting as well. I work in the emergency department, and patients get worked up in the ER for all kinds of things. Tons of unnecessary testing, which leads to those incidental findings. A friend of mine had the same situation just recently. He went to an ER and was ended up, because of the testing that they did, referred to two other physicians for something that was totally unrelated to what he had initially went to the ER for. And also patients, they're not always given all of the necessary information by providers and by hospital staff, and so that leads a lot to the unnecessary procedures as well. They really don't have a lot of as much say as they think in what's actually done to them. Government regulation and reimbursement also contributes to unnecessary health care expenses as well. And as for billing and reimbursement, non-invasive alternatives are oftentimes more expensive for the person, so that leads the control away from the patient to be able to decide what's done for them, because it costs a lot of the outpatient care, outpatient treatment, oftentimes can be more costly. Also, patients with it talks about cherry picking those patients, and sometimes those patients with better paying insurance may suffer more from unnecessary procedures because they have better paying insurance, and that's very unfortunate. And then also, due to reimbursement challenges, there's a lot of less private practicing surgeons, and that's due to the difficulty with reimbursements, and sometimes physicians don't want to have to deal with that difficulty, so they often just will join the hospital staff and do away with their private practice, and that is also a driver for cost as well. Hospital control. We know that hospitals do want to maintain control of their physicians in the hospital, and that way they can control the plan of care more. And it makes sense that the surgeons will then feel more pressure to do procedures that they don't feel are absolutely necessary because the hospital's in more control. They make it desirable for the hospitals make it desirable for new physicians coming out of school because they'll get steady paycheck, and they'll have kind of a routine schedule, and that's appealing to physicians. And that's definitely resulted in the lack of independent physicians. And this also, I've seen this in my facility that, long-term physicians that have been in the hospital setting and seen these changes over years, they're very disengaged and they're very disgruntled because they do feel that lack of control, and they feel forced into doing certain things just to make a paycheck. And you certainly can see it on those long-term physicians. And I'm sure it's very much a frustration for new physicians as well, coming out of practice, not expecting these type of things to happen. So those were all kind of stood out in my mind. And then also the competition for hospital surgery centers, taking those bread and butter cases that happens, and then the hospitals are left with those maybe underfunded patients, and or those more difficult procedures that lead to long-term hospitalization. We see that a lot of the time, and then that puts the hospitals at a disadvantage because they're trying to provide these services and get paid based on patient satisfaction, but they're behind the eight ball because there's this unrealistic expectation when you compare a hospital to a freestanding surgery center. So, in conclusion, there definitely needs to be some attention made to the restructuring the way that we pay for healthcare, and it should be based on the better healthcare outcomes for patients. Surgeons in hospitals should get paid less for unnecessary procedures, and there should be data out there to show the patients and inform them. Um, with transparency about unnecessary procedures, and then quality outcomes. Hospitals don't often have to participate in that public reporting of data if they choose not to, but that should be mandatory, and unnecessary procedures should also be a part of that. And people should be aware when those type of things are happening so they can make more informed decisions. And then insurance companies should also be more regulated in how they reimburse the hospitals and how they reimburse the surgeons as well. We talked a lot. My paper was around Germany's healthcare system, and it certainly, we could benefit from modeling another type of healthcare system in the way of reimbursement as well. So, thank you for listening.